Welcome. We're so excited to have you here today for this is our third webinar in our 2020 Practice Comeback Plan. We're going to be looking at our phase 2 recommendations around kind of getting back to preparing to get back to opening your practice. So be looking at, over the course of this few weeks, we're looking at key steps to succeed during and after this COVID-19 crisis. And again, today the focus is kind of on like, how do you get ready to reopen if you've been closed or if you've been partially closed? My name is Leah Chatham. I'm the Director of Content Marketing here at Solution Reach, and I have been doing education of one kind or another in healthcare and healthcare IT for about 20 years. I spent 5 of that as the person responsible for patient engagement and marketing at a small integrated health system, so I know what it's like to be on that side of things. And about 15 of it doing education for providers and staff for companies like Solution Reach that are involved in practice patient engagement, practice marketing, practice management, software companies, and EHR companies. So hopefully we'll have some good insights today. And I'm joined by Addison Reed, who's our customer education manager here at Solution Reach. He develops a lot of the education that we put in our community. He is also a former office manager, so again, he brings a lot of his own expertise. It happens that his mom also was an office manager, so it sort of runs in his blood. In addition to that, he is also the man with the coolest beard here at Solution Reach. We all really appreciate that. It's fun to get on a call with him and see his smiling bearded face. I'm going to hit on a couple of quick housekeeping items before we jump in. So the first one is we do want you to be able to ask questions as we're going along today. So just hit that little arrow next to questions on your toolbar, and we will try to answer ones, if it's technical issues or something like that. Obviously, we'll try to answer those behind the scenes. And as we're going along, if there are other things, we will try to address those behind the scenes too if we can, and if not, we'll respond to them as we're talking. And then we may have a little bit of time at the end to be able to answer any additional outstanding questions that you might have. A couple of common questions that come up quite a bit. One has to do with audio. We do find that people sometimes have trouble with their audio if they are listening to this on their computer. And so what we would recommend if you start having any problems is just go to the audio option in your toolbar, select phone, and then dial in. And that tends to be better than using the computer audio. Another common one is about whether or not you guys are going to get the recording or the slides. You will get an email after the webinar today that has the recording and the slides. So yes, you will get that, and you're welcome to share that with other people in your office or your colleagues. If you don't get that for some reason, definitely let us know. We're happy to follow up and get that out to you. If you're having support-related questions, what we recommend is that you go to community.solutionreach.com, click on My Support, or email community@solutionreach.com. You might also find when you go to the community that if you put a search into the search bar, you'll get the knowledge-based articles and videos that Addison and his customer team generate and do such a great job on. You might actually be able to find the answer to your question there. So definitely recommend that. So let's move ahead here and get started. We'll take a quick look at our agenda. Today, like I said, we are going to be focused on this phase 2 piece, which is about preparing to reopen. That really covers things like the tools you need come now, how to prep your office, setting your priorities and processes, looking at your reminders. Specifically, we're going to talk about how to have kind of a safe, healthy environment from, kind of a sanitation perspective, and to protect your staff and your patients, how to kind of determine that patient priority and get patients back on the schedule, how to communicate to patients what the process is going to be around reopening and getting people back on the schedule, and then how to set up your reminder cadence and some of the changes you might need to make for the short term, along with the use of things like PreVisit Instructions and pre-screening forms and things like that. So we'll talk a lot about the tools, we'll talk a lot about the best practices, all that kind of stuff. And before we hop into that, we do want to talk just quickly about, like I said, a couple of those tools to kick us off, and then we'll jump into more of the kind of general best practice discussions and tools that are available to you and how to use them. And the reason for that is that obviously, you know, things have been changing at a pretty fast clip here in healthcare over the last 4 to 6 weeks, and I think in particular the last 2 to 4 weeks. Obviously, everyone is looking at whether or not they can use telehealth to see patients right now so that they aren't entirely closed, really trying to find the right balance between patients you might be seeing in person versus patients you can see via telehealth and patients you have to postpone. We did do some research where we did a survey of our own customers. Here is what we found for our medical and vision providers. 66% currently have some kind of telemedicine in place, and 91% of those put that in place when this all started, sometime in February and March. So that means the bulk of the people using it really did not start using telemedicine until just recently. Many can plan to continue using it after this is over. Of the 34% who don't currently have something, quite a few are planning to add something in the future, whether that's, you know, in the near future to keep addressing COVID or, you know, possibly in an ongoing capacity. Because of that, and because we've been hearing from people in these webinars that there is a real need, and many people currently don't have a HIPAA compliant solution in place or haven't been able to get one in place, we have been working very hard the last 2 weeks to get something in place in the Solution Reach platform that you can use. So what we have done is developed SR Telehealth, which is a text-based, HIPAA compliant, secure video solution. You can launch it directly from a text conversation. Like I said, it is secure. You can pre-schedule these appointments and then send a link to the patient a few minutes ahead via text, or you can actually launch them on demand when you're doing those text check-in type interactions. So we do want to ask people, since this kind of came out of talking to you guys in these sessions and talking to our customers, we have a poll we're going to push out really quickly asking if you'd like someone to follow up with you with more information about SR Telehealth so that we can quickly get that to you if that is something that you're interested in. I'm pushing that out now. Let us know if you want somebody to follow up and give you a call, give you some more information. We'll give you guys maybe 30 seconds to fill that out. And if you're not sure now and you want to think about it a little bit, we are going to have a survey at the end of the webinar today, and one of the questions in there is if you'd like someone from Solution Reach to follow up. You can always say yes to that too. And we still got quite a few people coming in. I'm going to give it maybe 10 more seconds, and then we will. Okay, collecting responses. It looks like it's kind of coming to an end. I've had 1 or 2 people say that they're trying to answer the survey, but for some reason that's not working on their end. If that's the case, just say yes in the survey at the end, or shoot us a note here in the questions, and we'll make sure that we have somebody follow up with you. All right, I'm going to close that. So thank you. If you did answer yes, we will have somebody follow up quickly, because we know if you're saying yes, you probably need something sooner rather than later, and we're trying our best to provide solutions to support that. The other thing that has come out of doing these webinars with you over the last couple of weeks is that a number of people clearly are concerned about being able to get through this sort of comeback process on their own, especially if you have staff that have been furloughed and you're not exactly sure when they're going to be coming back, and you feel like your resources are a little bit strained, or you just feel like you're going to have to do a lot in a short period of time. We have developed a paid service for this practice comeback process. If you opt to do this, like I said, it is a paid service, but you get an assigned coach. There is a customized plan for your practice. They will make recommendations about how to prioritize your patients and get your schedule kind of up and running. They will confirm that your sync with Solution Reach is all working and the data is accurate. And then they will help you with setting up all your automated messaging, making any changes to templates and content, setting the cadence of your communications, setting up group messages and newsletters. And then, of course, you'll have access to all the free resources like this webinar along with all the free forms and templates that we've already created. So I'm going to push out another poll really quick for anyone to let us know if they want someone to follow up about that, knowing that the development of this has come about as part of this process, and that, feedback from many of you in asking about having a service like this. If you do want someone to follow up with you, let us know. Give you guys about 30 seconds to do that one. Again, if you're not exactly sure and you want to think about it, we have the survey at the end, and if you change your mind, you can always say yes and have somebody follow up with you from the survey. And for those of you who say you're having trouble getting the poll to work, again, say yes to the survey or put it in the questions, and we'll make sure somebody follows up with you. Okay, looks like the voting is starting to slow down. I'm going to give it like 2 or 3 more seconds, and then we'll go ahead and close it up. And boom, I'm going to close it. Okay. So thank you. We just wanted to make sure that we got that information out to you guys and gave you a chance to let us know if you were interested, because we know so many of you have been asking for these things. So we're very excited to be able to provide them, and I hope that it's going to be helpful for those of you who are in need of that. I am now going to hand it over to Addison. He's going to start talking about how to prep your practice for reopening, and the two of us will give you, I hope, some great content over the next 45 minutes or so on how to get ready for this next stage. Addison, it's all yours.
Awesome. Thanks so much, Leah, for helping us out to kick off this great webinar today and go through some of the tools and resources available. So I know what some of you might be thinking as you read through this slide. You might be thinking, Addison and Leah, this is no-brainer information. We know that we need to be cleaning our practice and doing some of these things, but bear with us, because for some of you out there, this may not be at the top of your mind. Especially if you're fully shut down for whatever reason, or seeing a very limited number of patients. So one of the first things you want to do to help to keep your practice safe for both your patients and your staff, take this opportunity to really do a thorough cleaning of your entire practice or clinic. Your treatment rooms, your waiting room, any equipment that's being used. I think we all have had moments at some time or another where we may have a little bit of downtime, and we see something in our workspace and we think, man, we really need to clean that, but I just don't have any time right now. Well, now's a good time, most likely. So take some time to really make your practice or your clinic or your workspace as clean as you possibly can. It's gonna it really shows to your patients. Your patients see a lot of these little details that they notice them. Along with that, you may consider designating someone as sort of a roving sanitization technician to keep everyone, your whole staff kind of on their toes about things that need to be cleaned or areas that need to be wiped down, that aren't treatment areas potentially, such as the reception area or things like that. Having someone that has their sole focus on that particular task can really help to increase this level of safety for the patients and staff. One of the other things that we've been seeing a lot of our customers begin to implement is they've been making use of a virtual waiting room experience. So what they've been having patients do is, as they arrive, rather than come in and wait in the waiting room inside the practice, they've been having them wait in their cars. And if you live in a large metro area, patients aren't really arriving at your clinic in their vehicles, they're on foot. They've been having them form a line outside, 6 feet apart in front of the practice. And on this next page, we actually have created some signage that you can use. You can print this off and hang it up. But this is a great way to help, again, your patients stay safe. You can have them just call or text you as they arrive for their appointments. You can make note of that and do the same thing back to them. Give them a text or a call to let them know that they're ready to be seen. Many of these customers that we've seen doing this have actually been locking their front door, their waiting room door to the clinic, because they don't want patients congregating physically in the practice. They're trying to do all that they can to really lessen any exposure or any risk for patients and staff, and trying to do their part to help flatten this curve of the spread of COVID-19. Some of the other changes you might take a look at making are physical changes actually in the practice, such as putting up some plexiglass to separate that reception area, and to keep those working in the administrative team safe and healthy. Some of the other options are removing things like the clipboards or removing the need to physically pay there in the practice. So going the digital route for offering patient payments and going the digital route for offering intake, the check-in process, this is going to help be more convenient for patients and for your staff, but it's also another great way to help mitigate any additional risks or exposure. And we're going to dive into some of those in a little bit, further slides down the way here. But again, in the space that you have, you may also want to do all you can to remove any non-essential items, whether it's brochures or displays or toys, things like that. Removing and limiting the number of surfaces that you need to watch for and keep clean can really help reduce some of the stress for both patients and staff. Now, PPE, this is one of those things that we really wanted to bring to the front of your mind. You probably, many of you probably are thinking quite heavily about this. PPE, we're hoping that you've done a great job and you're stocked and ready to go with your PPE supplies, because the worst thing would be to reopen and begin seeing patients like normal again, and then have to close down because you ran out of PPE supplies. So we would hate that to happen to you. So you may want to go about this in a way that is maybe a little more specific than you ever have done. You may want to look at the supplies that you have on hand and sort of ration those out and determine, okay, with what we have, how many patients can we see? Because then that can help guide you as far as the number of patients you actually put on the schedule. You don't want to run out of these supplies earlier than you may need to if you're a little more careful with how you make use of these supplies so that your staff can be kept safe and not jeopardized, and so that you can follow obvious norms that need to be followed in the healthcare space. If you have someone delivering those supplies, I trust me, I know how convenient it is to have them wheel all those boxes in on a dolly and help you get them into your stock room. This may be a time again to limit unnecessary people from entering the practice, such as delivery people or even salespeople. You might take it upon yourself to be the ones to move those boxes physically into your practice, and where applicable, maybe wiping down any packaging that needs to be, again, just to mitigate any risks that may cause further spread of anything that you don't want spread amongst your patients or staff. Now, Leah, this next slide, this is your favorite one. This is all about communication. So I want you to take it away for a moment and tell us, what's a little bit different in the way that we communicate right now.
Yeah, this is never before have we seen a period of time where communication was so important. For those of you who've been in some of the other webinars, you've heard this too. This really is a time to almost over communicate to some degree with people, and not just about things like, hey, we're having to cancel your appointment, or we're having to change your appointment over to a telehealth appointment, or we will be letting you know what's going to be happening with your appointment, but also all of this additional information about how to keep themselves safe, what's happening in their community as far as, shelter-in-place rules and wearing masks and all these different things. One of the best resources that they have really is getting information from their own healthcare providers. And you're in a unique position, unlike, say, the government, to be able to send them communications, right? So you have the chance to actually reach out to them directly, whereas most other sources they sort of have to find them themselves. And so we do strongly recommend that you continue to communicate with patients via some kind of newsletter, email, through social media, on your website, just to make sure that they know what's going on, to give them a heads up when it's time for you guys to reopen, so they know that's coming and they should be prepared to hear from you about how to reschedule their appointment, or that they may get a reminder and it might not be as much advance notice as normally they would get. Letting them know if they're going to have to use that virtual waiting room and stay in their car or wait outside, if they're going to have to wear masks and gloves in your office when they come in. Making sure that you've told them how they can communicate any of their feedback or concerns to you. The more you can do to communicate with patients and prepare them for exactly what is going to happen with their appointments or when they come in, the less stress and anxiety they're going to have, and the easier that's going to be for everybody. It's just right now people are feeling a lot of stress and anxiety, and you are in a position to help alleviate some of that if you really communicate. So that goes for your staff as well. So, you're going to have high risk employees in addition to high risk patients. You are potentially going to have employees who get sick, and you're going to have to be able to deal with that. So it's important to really know exactly what you need to do to ensure the safety of your employees, to communicate with your employees about everything you are doing to keep them safe, to make sure that if a staff member does get sick, that you're following all the recommendations for how best to handle that. And there are a lot of different ways right now that you can kind of plan for how best to minimize kind of interaction here. So some people have been having, some people are really closed, so staff are home, but a lot of people are partially open and having to have staff come in at least a little bit right now. Ideally, any staff who don't need to be in the office, like billing staff, should really be working from home. If you can just have one staff person in at a time, like a staff person and a provider, that's great. If you have to have two people, you might consider having the same two people at the same time every time, and trying to set up a scenario where there is some social distancing between them. Just really think about how you can do that in the best possible way to minimize risk for staff. But also, very importantly, meet with your staff regularly. Staff meetings, one-on-ones, ask them, how they're doing, what concerns they have, any issues that are coming up. People will need to be able to talk to you about that. This is a stressful time. Also, so that you can be sure you're addressing additional issues people have. People may need to have more flexible schedules because their kids are home from school, and no one's going back to school here anytime soon. So, or they may have a spouse at home who now has been laid off, and that's stressful. They're just important to make sure you're communicating with them and you understand all of the different sort of issues that they're dealing with, because a lot of people have kind of emotional issues and personal family issues, as well as financial issues and dealing with work. So support your staff, communicate with them, make everybody feel as safe as you possibly can. And finally, I'm going to let Addison take this one. You don't have to open.
Yeah, you're absolutely right, Leah. Yeah, Leah and I both understand, from a perspective of being there in the trenches, in a practice, we understand how enticing it can be to have someone say, hey, you can officially go back to work. We understand the draw of wanting to rush back to work and open the doors and see patients as quickly as possible. Not only to help with the revenue of the practice or the clinic you're at, but also to see patients, right? To help continue to maintain the patient relationships you've worked so hard to build over periods of time. But if you're not ready, it's okay to not open right when everybody else is. Just because some different guidelines and things are relaxed doesn't mean you have to immediately open. And in fact, if you don't have some of the different processes in place, or you don't have ways to prioritize the treatment you provide, you may not want to open until you have some of those things in place. And it's actually what we're going to cover here in the next kind of section of this.
Yeah, actually, before we move ahead, Addison, one of the things is that we've had a bunch of people say, hey, do you know where we can get some of these supplies, because we're trying to order and everything is back ordered. It's hard to get the supplies that we need. We're obviously not experts in medical supply chain. That's not our that's not our area of expertise.
Right.
But we are hearing this from everyone, and we know this is a frustration. I wish we had a magic wand to be able to help you guys do that. But I think this is where what Addison is saying about, you may want to open next week, but it may not be feasible. Everyone will have to be realistic about, can you get all the supplies that you need? Does that mean you have to delay a little bit more to open? It may. But it is, the most important thing is ensuring a safe environment for your staff and your patients. And so you'll have to kind of make those decisions as you have the information available to you.
Yeah, and some of the things, just to talk on that theme, just for a quick second more. Again, you may look at, let's say you look at a box of gloves, and the box of gloves has, okay, we've got 300 gloves in here. That means 150 pairs. So how can we best use that 150 pairs of gloves, right? You almost have to treat these supplies like they're made out of gold, because they're extremely valuable right now, right? Especially if you don't have any other shipments coming anytime soon. So do what you can. You may look at even changing up the way that you provide treatment to patients to some degree, to reduce the amount of individuals that are part of your staff that need to interact with that patient and therefore need to wear PPE. My brother is a dentist, and that's one thing that they are doing. He is taking charge of some of the different procedures that he usually has some help from different members of staff. He's deciding to do some of those things on his own so that they can reduce the amount of PPE that needs to be used at the practice. So, that's just one more idea that may work for you. It may not, but yeah, we feel for you. Honestly, I've been in situations where we have had to be really careful with how we use our PPE because a shipment's been delayed or other things have happened that are outside of our control. But you can do this. You've totally got this. So back to this topic of things that you need to do, perhaps to prepare before you are ready to open, even if everyone else is ready to open. Some of the things that you may want to take into account are the patient priority. So if you have patients that are on the schedule, we recommend keeping as many of those patients on the schedule as you can, because as you start to pull patients off of your books, those are more patients you're going to have to juggle and shuffle and shift around, and it can be a lot more stressful for you. It can be very stressful and frustrating for the patient if they aren't sure when they're supposed to be seen, things like that. In previous sessions of this webinar series, we've talked about, it's probably many of us have experienced situations where we've had to cancel appointments. We've probably attempted to reschedule them, but since it's a bit of a changing landscape with everything that's been going on, many of our patients we probably had to cancel. And we've talked about the importance of creating a list of those patients. And this is one of those times when you can really make that list extremely useful for your practice, especially when it comes to developing the priority in which you should begin rescheduling those patients. Now, you know better than us which patients need to be seen. You have a better handle on the individual patients that need to receive some sort of treatment. Otherwise, their condition or their situation is going to get worse, which may necessitate more treatment or more expensive treatment down the road. So we recommend you take a look at that and take that into account. Those patients you may prioritize above your other patients. For example, those patients may be prioritized much higher above patients who are coming in for just an annual checkup, things like that. Again, we leave that up to you, but take this into account that patients have different levels of priority and you have complete control over who is seen. So take advantage of that. Some of our customers they're really changing up ways that they've been working. A lot of our customers are completely getting rid of that mindset of, well, this is how we've always done things. We've always done it this way. They are saying we can't afford to think that way anymore, because we're going to get eaten alive with the demand from our patients. So they're going so far as to dedicate specific days to treat high-risk patients. Some of our customers have said we're taking a page out of the book of people running supermarkets where they are open for certain hours to allow seniors to shop. They said, why can't we do that in healthcare? Let's do it. So they are starting to open. Some of them have Saturdays that they see their seniors. Some of them have decided, well, we don't want to be open extra days, but we will extend our hours to accommodate those individuals that are in those high-risk populations. Whatever works for you, take advantage of that. Pull every lever that you can to make accommodations for your patients, but also keep your patients and your staff healthy and safe. Now, another thing is the processes. The individual processes that you have in your practice, they may need to change. You may need to create totally new ones that you've never done before. So, for example, we talked a little bit about the check-in process. You may decide to ditch the clipboard and ditch the pens and go completely virtual. You may decide to do what we talked about earlier and close the waiting room and allow patients to wait in their cars or wait in a line 6 feet apart outside the practice. Again, you may want to install those safety barriers to keep everyone safe. And along with seeing patients and beginning to open back up and start offering more of your regular treatments rather than just emergency things, you may also want to determine that there are certain individuals who are allowed to arrive at the practice. So for example, if it's just the patient, they can't bring a +1 anymore. This isn't a dinner date. Or if it's, they need a necessary caregiver, bring just the one caregiver. You don't need anyone else tagging along. In family situations, if you're at a pediatric type of practice or clinic, then, obviously we want to make sure that families are seen as necessary, but you may need to limit it temporarily and say, hey, we can only have the patients who are being seen and they're designated, one parent or guardian with them. We can't have the whole family rolling in like one big family reunion. We got to limit it for right now. And along with these different processes and priorities and the way that you see patients, what's going to help reduce friction and reduce frustration for your patients is, as you implement these things, take it upon yourselves to help educate your patients as to the reason why. Because if they can understand your reasoning for this, and they can be helped to kind of connect the dots and realize, my provider is doing this so that they can keep me and my family healthy and safe. This is, again, it's going to reduce friction and help them understand that you care about them and not just their pocketbook. This is a great opportunity to help them show really how much you care about their health. We talked about it previously. I know, some of us, we might be looking for every opportunity we can to not have salespeople come into the clinic. This is a great opportunity, again, kind of along the same lines as delivery people. If we can eliminate the need for any non-essential people to arrive in our practices, we should take advantage of that. For those deliveries, again, maybe have them deliver the supplies to the back door, and you and your staff take charge of getting those into your stock room, or let the salespeople know, hey, we are only seeing actual patients in the practice. Please just give us a call. We would really appreciate that. And again, you can tell them the same thing that you're telling your patients. We want to keep you safe. We want to keep our patients and our staff safe. So please, communicate with us in that way rather than dropping by. You may even ask your patients to wear some PPE of their own where possible. I actually have an appointment coming up with one of my providers this next week, and I'm fully expecting that I need to, do what I can to make them comfortable as a patient by arriving with the necessary things. So I'm planning on going in with a mask, to help them, just be a little less stressed about me as a patient, and to help keep them safe as well as me and my family safe. Thanks for letting me ramble here for a second, Leah. Anything that you want to
I do. We've had some questions. We have a pretty broad combination of practice types on our webinar today, and there's a number of people in specialties where you may have, it could be vision. Several people have asked about, like, how are we going to deal with, people trying on glasses, or specialties where maybe you have other kinds of things that patients actually purchase at your practice and take with them, supplements, other kinds of products. And that is kind of an issue. And we've been hearing from a lot of experts some good recommendations about how to deal with that. So many of you are asking, like, what do we do? What do we do? So on the vision side, one thing I'll say is actually there are some online services that you could be using where people can sort of virtually try on glasses right now if you needed to be doing that. But what we're hearing from most people is that the best approach here is really to only have opticians pulling glasses. And the upside of that too is that often people choose from the first one or two pairs of glasses that are shown to them. So it can make the process a little bit faster. You can also choose to go a little higher end for that. So that could be a good thing. Same with things like supplements. I know Addison and I were talking about this on another webinar the other day, and he mentioned also you can make it feel a little more concierge, try to make it sort of a positive experience. Someone here said, well, what about people who want to bring their spouse or something to see the glasses? That just may not be an option right now, unfortunately. But you could say, hey, we can take pictures. You could text some pictures to your husband if you want him to see your final two choices of glasses. You're just going to have to find some innovative ways to deal with some of these things, because honestly, you just can't have, every member of the family coming in and rifling through your stuff.
You're totally right. And like in the case of like glasses, if you want, you want a spouse to come in and see how they look on you, pull your phone out. Recommend it to the patient.
Yeah.
Hey, why don't you FaceTime, your spouse and let them see your cute new frames?
Right. Even better.
Technology
Yeah,
is a
totally.
great piece of
FaceTime,
it.
Zoom, whatever.
Yeah,
Yeah, there are options. So we just have to work together to find the best ways to get through these interesting times.
yeah. These are great questions though coming through. Another big topic is especially as we begin to reopen, right? We begin to start seeing patients for non-emergency procedures or treatment. Um, this is going to happen in that we're going to be seeing patients who have been tested positive for COVID-19 and have recovered, or patients who are currently experiencing symptoms. So, with that in mind, since it's going to happen, you need to have a process in place. Ask every patient if they've tested positive or if they currently have symptoms. And if they do have symptoms, ask them to contact your practice so that then you can take care of them accordingly or route them to designated places in your geographic location as to where they should be seen or treated. Some of our customers are taking temperatures of their patients in their car or as they wait in line outside the practice before they even allow them to come into the practice or clinic. And we understand that that may feel a little strange or a little weird for the patients. They're thinking, I've never had my doctor do this outside of the practice. This is kind of strange. But again, take the opportunity to educate them and communicate with them and help them understand the reason why and tie that back into the purpose of keeping them and your staff safe and healthy, and it'll reduce that friction. Many of you may be receiving requests or you may be requesting from primary health providers documentation from those who have been infected with COVID-19 and have recovered, so that you have proof that yes, this patient has fully recovered. They are no longer contagious, or they're no longer at risk of infecting other people. That is most likely going to happen. So prepare a process to either send those requests or as you receive those requests to fulfill them. That's like I said, it's going to happen. It's inevitable in this case, especially as we start to reopen the practices. When you think about adjusting the scheduling process, Leah, I know you and I have talked at length about this because it's so convenient to just jam as many appointments in your appointment book as possible, because the inevitability is patients cancel or they no show at the last minute. So what's the main reason that we may not recommend doing that for this time, a temporary time as we return to practicing medicine?
Yeah, it's so tough because we are used to, doing more of a stacking approach to appointments. For many of you out there who might see, say, a lot of Medicaid patients who have traditionally a higher rate of no-show, or other categories of patients who maybe are more likely to no-show, even double booking can be common. So this is sort of a new world here in how we're going to move forward over the next few months. It is not going to be a great idea to stack or double book. You're more likely to need to stagger appointments. You probably are going to need to add some time for additional cleaning and sterilization at a level you did not do previously. You are probably going to need to look at things like doing a virtual waiting room where people pull up in their car and text you or stand outside. You may even need to mark off those sections at 6 feet apart. Or if it's indoors, mark off sections at 6 feet apart. You may need to remove some of the chairs from your waiting room and space the chairs to ensure that you're supporting social distancing. Same goes for your exam rooms. We work with a lot of dentists, so this is a great example in that we're sort of trying to provide some ideas here, but essentially using only half of your chairs for the time being so that you can provide appropriate distance in terms of social distancing. This would go for any other provider as well. If you traditionally move patients very quickly from kind of one place to another, or if you have tight spaces where patients are passing in the hallway and people are close together, you are going to have to think about how you can space those appointments a little bit more, coordinate in a way that allows you to move patients safely without them being too close together. It may mean not using all of your exam spaces, the way you traditionally have. And unfortunately, that really is just the way it's probably going to be, especially given that we're going to be continuing to try to prevent kind of a resurgence of COVID until we have some kind of vaccine, which is some ways away. And there also is this issue that you may have to very quickly kind of switch back to scaling back down, or going back to telemedicine if there is another big outbreak somewhere. So it's best to think now about how can we support social distancing for as long a time as is necessary, and have processes in place that allow us to be able to keep things as sanitized as possible. All those factors could go on for quite a while. The other thing is, normally we strongly recommend that you have some kind of cancellation policy and even a cancellation fee. This may not be the time for that. It may be worth considering either letting that go entirely or adjusting that. The first reason is that you may not be able to give people initially as much time in terms of a reminder as you normally would. You might be giving people just a couple days notice that, hey, we are going to be able to get you in for your appointment, so plan to come in. And it may not be enough notice, if they have forgotten about the appointment or thought that it might be canceled. The other thing is that this is a very stressful time for people. Everyone's kids are home from school. People sometimes have multiple family members. I know of several people who actually have taken in elderly friends and relatives and have a house full of people right now that they are sheltering in place with. And so their responsibilities have changed. People simply may not have the resources, or they may be too anxious to come in, and they may not really realize that until the last minute. So we need to be understanding about people's level of stress and anxiety and all of the personal issues that they are all dealing with today. So just consider making some changes to the way you do things to support that, and to continue to support some of the things we're going to be dealing with here probably for quite some time. I'm going to hand it back over to Addison here to talk a little bit more about processes and finishing up that conversation a little bit here too.
Yeah, and Leah, you hit the nail on the head. One of the thoughts that just came to my mind is many of our patients, they may not work in healthcare like we do. And so they only have, kind of one level of stress, right, about being seen as a patient. For many of us who work in the healthcare space, we have another lens, to view that with, right? If we are working in a practice, we have stresses of providing treatment or providing healthcare to patients, but we also have the stress of being patients ourselves. So if there's anything that we can do to think of how we would want to be treated as patients by our own providers, that's a great thing to echo in the way that you treat your own patients. And again, anything that you can do to help reduce any of that stress and anxiety about being seen, at the practice, we recommend that you take advantage of those and make changes where needed to help reduce those feelings. But again, we've gone through a few different ways that you might look at prioritizing patients, and some of the different new processes you may create, or ways to adjust existing processes. But this is when we recommend that you open. Once you have a process in place, you should open at that point. And then once you're open and you have processes, then you can kind of announce it to your patient base and let them know that you're open, you're ready to receive them. Now, again, pull every lever that you have. Send out messages through text, through email, update your patients via social media or your website, even change the voicemail on your phone so that patients who call in are still hearing, oh, they're open, we can be seen, I can schedule an appointment now. Like we said before, communicate with your patients and help educate them on opportunities to perhaps schedule their appointments online or request appointments online rather than needing to communicate with the practice directly to do that. You can share any of those online scheduling links through those other ways in which you're communicating with patients, through email, through text, etc. Again, just get the word out to your patients as in any way that you can, that you feel comfortable doing, that is also in line with your brand, right? Some of the other changes that need to happen in the practice may be specific to the messaging that you provide. So whether it's your appointment reminders or pre-visit instructions, which are messages that are sent out at the same time as an appointment reminder, Leah, you hit on this earlier about our SR success formula. This is what we have recommended for over a year now of ways to be successful in the practice to improve the patient experience, to increase revenue for the practice, improve the way in which you see and treat patients. And a lot of that relies heavily on having a cancellation policy in place. But right now is a great time to be a little more relaxed with that cancellation policy. But at the same time, you need to make sure you're doing other things to help improve the confirmation rate. So this is where you may be familiar with the 333 concept that we came up with. This is backed by data, and we've been in business for 20 years, and we've used our information that we've collected over the 20 years to come up with that. And this refers to sending out appointment reminders 3 weeks, 3 days, and 3 hours prior to an appointment. Now, this is a changing landscape. So that 3-week reminder, that may not work. You may want to adjust that temporarily to be 1 week and 3 days and 3 hours. Whatever you decide to do, this is your way of still trying to subtly help your patients follow through with the appointments that they've made and actually show up on time without having to penalize them with that negative experience, which is sometimes the cancellation fee. So having a reminder cadence in place, and again, having the option to send reminders automatically rather than having to call every single patient, that's going to save you so much time. With PreVisit Instructions, this is again an opportunity to pre-screen. If you can send this message out at the same time as an appointment reminder and say, hey, if you are experiencing any symptoms that are questionable or that are involved with COVID-19, please give us a call before you arrive. Then you can route those patients accordingly. This is another, like we said, another great tool to use to do some pre-screening. And while you can't click on these links here in the webinar, like Leah mentioned, we're going to be sending out these slides, and these links will be clickable so that those of you who are Solution Reach customers can see the how-to articles on how to go about creating or editing your pre-visit instructions. Another great option for doing some pre-screening, which we've talked about previously, is changing up your intake process. So for those of you who use our intake tool, which is SR Intake, we've created a COVID-19 questionnaire that can be added to the intake packet, and that can be sent out to patients at your leisure and filled out by patients at their leisure. But you may also, if you already have questionnaires built, you will want to send links to those screening questions prior to an appointment to your patients. If you still elect to go with pen and paper, we're even providing you with a printable questionnaire of these questions so that you can still hand them to your patients, have them fill them out, because we want to arm you with every single tool that we can think of that is going to help you be successful, but also keep your staff and your patients safe. So again, this take into account some of the different things that we've covered today, the different ways to prioritize patients, the different processes to put in place, and see what will work for you. And again, just because everyone else is opening doesn't mean you have to yet. If you feel like you need to really solidify those processes before you reopen, go with that. Go with that feeling, and then reopen with confidence. Leah, I will turn it back over to you right now.
Yeah, definitely you want to feel confident. I think that is such a great way to put that, Addison, to say, feel good about your plan, feel like you've taken every possible precaution, and you're not just thinking about, boy, we need to get open, we need to be bringing in money, but you're also thinking about the safety of your staff and your patients. I know it's so hard, but it's sort of what we all have to do right now. So as we wrap up here, please do throw in any additional questions you have. We have a couple of minutes, so we can get that going. I noticed I have the date wrong on here. I think your final session actually is next Thursday, April 30th, not April 29th. I apologize for that. Someone just pointed that out to me. So just a reminder that third session is next week. If you haven't registered already, we hope that you will register and join us for that. Also, I wanted to mention, for those of you who are interested in more about that 333 cadence that we talked about and the research behind that and all the recommendations, you actually can download that white paper here in the handouts section that is in there for you to click on and download. Some people I know really like to kind of see all the meaty details in there, so that's there. Another reminder that you will be getting the email after this with the recording and with the slides for those of you who wanted that. And if you did say yes to either of those polls early on, we'll make sure somebody follows up with you. And then I know several of you missed the poll and have been putting it in the questions like, hey, please call me. We'll make sure they follow up with you as well. And I do want to re-mention that if you are interested in SR Telehealth or in the Practice Comeback service, or honestly in any of the things we talked about today, whether you're a Solution Reach customer or you are not, and you're just kind of checking things out, trying to get some good information, and you might be interested in learning more, there is a survey that you're going to get when we close the webinar, and it'll ask you if you want someone from Solution Reach to follow up. Just say yes. We'll have somebody follow up with you and answer any questions you have, show you demos for any of the products that you are interested in. We're happy to do that. Also, you'll notice in that survey that we ask if there are any additional questions that you have that we can try to get answered for you, or any other topics that you're interested in. We are definitely interested in getting your feedback about those things so we can figure out if there are other webinars we need to be doing. We've been looking at the possibility of doing a Q&A style webinar with a lot of the additional questions that we've been getting. But if there are other topics we can cover, either in a webinar or in a downloadable piece of content or in our FAQ videos, we really want to get those questions from you. And if you have not seen our FAQ videos, you can find those on solutionreach.com/resources. That is a great resource. And we actually are developing a bunch more of those with questions that have been coming up in these webinars. So definitely check that out. We do have a few minutes. I'm going to scan through and see if we have any last questions that we can answer, Addison. And it looks like, I just saw one and I thought, oh, we should answer that. And now so many things are coming in that I lost it.
A flood, huh?
I know, a flood of stuff. Okay, so this is a common question we have been getting, and we've gotten it again here, which is, basically, once we know when we're reopening, when should we actually turn back on our reminders and start rolling those out?
Great question, because if you have, let's say I'm gonna reopen my practice next Monday. Well, if I turn my reminders on next Monday, that doesn't help me out, right? Because then they haven't had time to try and confirm my patients for me. So again, this is another thing you may think about when, in regards to the day you're going to reopen. Just because you can be open, let's say it's today, doesn't mean potentially you should. So I would recommend that you turn your reminders on right around a week before you're going to reopen, if you can. If you have automated reminders of any kind, I would recommend, if you don't have the luxury of opening, a week away from turning those on, look at your reminder cadence that you're currently using and take that into account to allow your patients to receive some of those appointment reminders ahead of time. Even if it's just, hey, we're going to reopen in 3 days. Great. You may temporarily adjust your reminders to be sent out 2 days in advance and then turn them on, because it's much more preferable for patients to get at least one reminder that's automated versus you having to rely on picking up the phone and calling every single person. That's just stress that you don't need right now, honestly. And patients prefer to be communicated with via text. So, talking with them and communicating with them through that preferred method is also going to help increase the chance that they're actually going to confirm their appointment. That's how I would put it in a nutshell, Leah.
Yeah, and the other thing too is, even if you aren't ready to turn on your reminders, but you're going to probably be opening in, say, a couple of weeks, like we talked about earlier, it might be that the solution for that is to send out some kind of email newsletter saying, hey, we are monitoring the situation and the recommendations in our state. We are thinking we are probably going to reopen around this time. Watch for reminders for any appointments you have scheduled, and just give people kind of a heads up. There are other ways you can kind of communicate to give people that, a little bit of a heads up before they get that first reminder too. Yeah. Okay, and speaking of reminders and pre-visit instructions, Addison, we had somebody ask, do pre-visit instructions show up in both text and emails?
Great question. Right now, PreVisit instructions show up in text form only, as far as I'm aware. I'd have to talk to our product team and see if anything's coming down the pike. But as far as I'm aware, they only are being sent via text right now. So take that into account as you have to work with character limits. But yeah, hopefully that answers the question
Okay.
there.
I didn't even know that. I mean, I knew that they were getting them in text. I didn't realize that they weren't available yet in email. Okay, and then we've had a couple of questions clarifying some things about SR Telehealth. So I do want to I'm just going to generally very quickly respond to those. So SR Telehealth is you need to have SR conversations to use SR Telehealth, but SR Telehealth is a video solution. So for those of you who've asked, do you guys offer video? Is SR Telehealth just text-based check-ins? Text-based check-ins can be done using SR Conversations, our two-way text messaging tool. SR Telehealth can be launched from Conversations to conduct secure HIPAA-compliant video visits. So I hope that answers for the several people who had questions kind of around that topic. I hope that answers that question. And I think...
You know what, Leah? I want to dive in here. I need to correct myself real quick. PreVisit instructions are sent out both via email and text.
Oh,
I apologize for that mistake.
That's what I thought. That's what I thought. And I was like, oh my gosh, I've been wrong all this time.
Now, as soon as I said it, I got that little inkling in the back of my head saying, I don't know if you're correct here. Sure enough, I'm not. So email and text is instructions. Thanks for letting me jump in and correct myself.
Okay, so here's our last question, and I think this is something we're probably going to address a little bit more next week as we talk about getting into your growth phase. It's regarding recall, which, we've obviously told everyone, hey, turn off your recall right now. But moving forward and preparing to reopen, we're also kind of saying you're going to need to pace yourself, right, in terms of when you turn that recall feature back on, because obviously we're trying to get people scheduled. So this person's kind of saying, when do I turn recall back on? I think that's going to vary for everyone, right? You're not going to want to turn it back on until you've gotten all these other people into your schedule, you're caught up, and you're kind of back to normal. What are your thoughts?
I think you're totally right. It'll probably vary for everyone. And it'll vary depending, like, one of the factors that comes to my mind is how full your appointment book is right now. And how big that list of patients is that you had to pull off your schedule as you kind of closed and started only seeing patients for emergencies. If you feel like that is a sufficient list to work from to start filling some of the holes, you may decide to wait a little bit before turning your recall back on. If your appointment book isn't that full and your list of patients to fill holes with isn't that big, you may elect to turn recall on a little earlier. And keep in mind, with recall, you can actually, you have control over the throttle. And by that, I mean the number of recall messages that are sent out per day. So if you're coming back from this and your throttle is set really high, something like 300 messages sent out per day, that you may get swamped really fast. But alternatively, if your recall threshold or your throttle is very, very low, it may not start helping to fill up those holes in your schedule fast enough. So you may adjust it to go a little higher. That's one thing you'll definitely want to keep an eye on as you reopen. Great question, though.
Yeah, no, and I had somebody who just said you can turn recall on and off. Yes, you can.
You better believe it. Yeah.
Yes, you can turn your recall on and off. And if you need our help with that, definitely go to community.solutionreach.com and we can have somebody can walk you through how to do that. You do not want your recall messaging on right now. And then, we've got several people too who are saying, hey, I am trying to figure out how to do some, visit instructions and other things. I do want to say, someone just mentioned that they tried calling in earlier and there was a long hold time. We understand that it has been challenging at times in this last few weeks. Sometimes we've had very high hold times on support. I hope that all of you understand that it is because almost all of our customers have had something they have had to deal with in the last few weeks in terms of turning on and off different portions of their system and needing assistance with that, or sending out messaging that was unexpected messaging. You may or may not be aware that in the first or second week of kind of things shutting down, we sent out over 60 million messages on behalf of our customers. A lot of those were messages we had to help format ourselves. We are very sorry for any wait times anyone is experiencing, and I promise you that we are doing our best to get to people and get things resolved. So we appreciate your patience, and please do try to use the support chat through community.solutionreach.com, or go search for the topic you're looking for and see if you can find the instructions there, because a lot of those instructions are in there and they're very easy to follow. I know that because Addison created them and he's very good at that. So we appreciate everybody understanding that, you know, sometimes you may have been able to get in a couple of minutes and get your stuff addressed, and we always hope that will be the case, but there have been some times where that hasn't been the case, and that's the reason why. So we appreciate people understanding that, and we do apologize for any waits that you've had. Anyway, so I'm going to go ahead and close out the webinar. I just want to remind you that if you do want more information about anything, just say yes. I'd like somebody to follow up with me in the survey. We'll have somebody follow up with you. We are looking forward to seeing you all next week on April 30th, not April 29th, for the next and last session of our Practice Comeback program. Thank you so much, Addison, for all the great information you provided today.
Absolutely.
And thank you, everyone, for joining us. Please stay safe, and we'll look forward to seeing you again next week. Have a great day, everyone.